A very confusing thing families hear when learning about chronic traumatic encephalopathy, or CTE, is that doctors cannot diagnose it while someone is alive. That sounds strange at first. If someone clearly has neurological symptoms, a long history of head trauma, and a pattern of behavioral or cognitive decline, why can't doctors confirm the diagnosis? The answer lies in how CTE is actually identified. Unlike many neurological disorders, CTE is not defined by symptoms alone. Instead, the diagnosis depends on seeing a very specific pattern of microscopic damage in the brain. These changes occur at a level that current medical imaging cannot detect with certainty. So even when doctors strongly suspect CTE, they still cannot officially confirm it during life. This can be frustrating for families looking for answers, but understanding why this limitation exists can help people better understand what doctors are actually looking for and what researchers are working to solve. Chronic traumatic encephalopathy is a neurodegenerative disease associated with repeated head impacts. It has been studied in athletes from contact sports, military veterans exposed to blast waves, and others who experience repeated head trauma. Over time, these repeated impacts can trigger abnormal changes inside the brain cells. One of the most important findings researchers look for is the accumulation of a protein called tau. Tau normally helps stabilize structures inside neurons, but when it becomes abnormal, it begins to clump together and spread through the brain. These abnormal tau deposits disrupt communication between brain cells and eventually lead to degenerative brain issues. In CTE, these tau deposits form in very distinct patterns. They tend to appear around small blood vessels and concentrate in the deep folds of the brain called the sulci. This pattern is what distinguishes CTE from other neurological diseases, and it's also the key reason diagnosis requires direct examination of brain tissue. Right now, the only way to definitively diagnose CTE is through a neuropathical examination of the brain after death. During this process, specialists examine brain tissue under a microscope. They look specifically for the characteristic pattern of tau protein deposits associated with CTE. This process was standardized by the researchers working with the National Institute of Health and other neurological research centers. The pattern they look for is very specific. It involves clusters of abnormal tau proteins forming around small blood vessels in the depths of the cortical folds. This microscopic pattern distinguishes CTE from diseases like Alzheimer's disease, which also involves tau, but appears in different distribution. Because this diagnosis requires direct tissue examination, it cannot be confirmed through routine medical or blood tests. As a result, doctors working in living patients must rely on clinical symptoms and patient history rather than definitive pathological diagnosis. Many people assume that modern brain scans should be able to detect CTE. After all, MRI and CT imaging can show strokes, tumors, bleeding, and structural brain damage. But the changes that define CTE occur at the microscopic level. MRI scans are excellent at showing large structural changes in the brain. They can detect brain atrophy, swelling, bleeding, and other physical abnormalities. However, they cannot currently visualize the specific microscopic tau deposits that define CTE. These deposits exist at a scale that requires a specialized laboratory staining and microscopic examination. Researchers are studying advanced imaging techniques, including certain types of PET scans that may eventually detect abnormal tau proteins in living patients. But these technologies are still being studied and are not yet readily available to diagnose CTE clinically. So while imaging can sometimes show indirect signs of brain injury, it cannot yet confirm the disease itself. When doctors evaluate a living patient who may have CTE, they use a different clinical framework. Instead of diagnosing CTE directly, clinicians may diagnose something called Traumatic Encephalopathy Syndrome, or TES. TES describes a pattern of symptoms that can occur in people with a history of repeated brain trauma. These symptoms may include mood changes, behavioral problems, cognitive decline, or motor symptoms. The purpose of TES diagnosis is to provide a clinical way to recognize and study the syndrome in living patients. It allows doctors and researchers to track symptoms, study progression, and develop treatment. However, TES does not confirm that the person definitively has CTE. Only post-mortem brain examination can provide that confirmation. This distinction is important for both medical and research patient care. It allows doctors to acknowledge the neurological symptoms people are experiencing while remaining scientifically accurate about the limits of current diagnosis tools. Another important point about CTE is that early symptoms often look very different from what people expect. Many families assume that memory loss is the first sign of a neurodegenerative disease. But with CTE, early changes often appear in mood and behavior rather than memory. Families may notice increased irritability, depression, anxiety, or sudden emotional changes. Some individuals develop impulse behaviors or difficulty controlling anger. Sleep disturbances are also common. Over time, cognitive symptoms may begin to appear. These can include difficulty concentrating, problems organizing tasks, or trouble remembering recent events. As the disease progresses, symptoms may begin to resemble other neurological conditions, including dementia or Parkinsonism movement disorders. Because these symptoms overlap with many other conditions, it can be difficult to determine exactly what is happening in the brain without direct tissue examination. One of the reasons CTE is so widely misunderstood is that the symptoms overlap with many other neurological and psychiatric conditions. Mood disorders, depression, PTSD, substance use, traumatic brain injury, and neurodegenerative disease can all produce similar symptoms. Without a definitive diagnostic test for living patients, doctors must carefully evaluate multiple possibilities. This can sometimes lead to frustration for families who feel certain that the repeated head trauma must be responsible for the changes they are seeing. Researchers are working to better understand how these conditions overlap and how repeated brain trauma contributes to long-term neurological changes. Improving diagnostic tools is one of the major goals of current CTE research. Scientists hope that future imaging techniques or biomarkers may eventually allow doctors to identify the disease earlier and more accurately. Researchers around the world are actively working to develop tools that could detect CTE in living patients. One area of research involves advanced PET imaging that can detect abnormal tau proteins in the brain. Another area focuses on identifying biomarkers in blood or cerebral spinal fluid that may reflect disease process. These approaches are still being studied and are not yet approved as definitive diagnostic tools. But the progress being made in neuroscience is significant. As technology improves, it may eventually become possible to identify the disease earlier and develop targeted treatments. Understanding how CTE develops and progresses is a critical step towards protecting brain health and supporting individuals living with neurological injury. For families dealing with possible CTE symptoms, the lack of definitive diagnosis can be difficult, but it's important to remember that treatment and support do not depend on confirming the exact disease. Doctors can still address symptoms such as mood changes, sleep problems, cognitive decline, and movement disorders. Neurological evaluation, mental health support, and lifestyle interventions can all play an important role in managing symptoms. What matters most is recognizing neurological changes early and seeking appropriate medical care. Even without a definitive diagnosis, individuals can receive support, treatment, and guidance. CTE remains one of the most complex neurological conditions being studied today. While researchers have learned a great deal about how the disease affects the brain, many questions still remain. What we know today is that repeated head trauma can have lasting effects on the brain. We also know that understanding these effects is critical for protecting athletes, veterans, and others exposed to repeated brain impacts. As research continues, scientists hope to develop tools that allow earlier detection and have more effective treatment. In the meantime, awareness and education remain essential. I'm Heather with Robbins Nest Alliance. The more people that understand brain injury and neurological disease, the better we can support individuals and families facing these challenges. Thank you.